Hey guys, Tavis Piatoli, sports dietitian with the Taylor Hooten Foundation. Today I am super excited about a conversation I'm going to have with Dr. Beth Pieroff from Rush Hospital in Chicago. Dr. Beth, thank you so much for spending the time with us today. I know we have a lot of stuff to talk about. We're going to talk about really the impact of just what is quarantine doing to kids, adults, and all of that great stuff. How are you doing today?
I'm doing well. Thanks for having me, Tavis. I'm looking forward to the conversation.
Absolutely. We want to give people a little time to get into the room. I know we are live, but I know a lot of people are going to be joining us. We have a lot of friends and a lot of people that follow the Taylor Hooten Foundation that has really, they've just been texting me going, hey, I'm really excited to see this session. I really want to know because there's just so much unknown going on right now in the world with going back to school. I'm in Louisiana. We found out today schools in New Orleans are going to be going virtual. We're still waiting to hear what's happening on my daughter's side. So there's just so much unknown. Before I get to the questions for you, though, I want to know, I want our listeners and followers to kind of know a little bit about you. So Dr. Pieroff is a board certified clinical neuropsychologist and the director of the concussion program at Midwest Orthopedics at Rush University Medical Center. She's been involved in the assessment of players in the National Hockey League since 1997 and is the head injury and concussion specialist for the Chicago Bears, the Chicago Blackhawks, the White Sox, the Fire, and the National Women's Soccer League. Now, I'm upset because I'm a Cubs fan. I don't see the Cubs on. Dr. Pieroff is the co-director of the NFL Neuropsychology Consulting Program. She is also on the board of directors of the Brain Injury Association of Illinois and is a member of the USA Football Heads Up Advisory Committee, the NFL Head, Neck, and Spine Committee, the U.S. Soccer Concussion Task Force, and the Amateur Hockey Association of Illinois Safety Committee. She has been awarded the 2018 Chicago Illini of the Year Award, the 2016 USA Hockey Excellence in Safety Award, and the University of Illinois 2016 LAS Alumni Achievement Award, the 2014 AHAI President's Award, and finally the 2012 Brain Injury Association of Illinois Make a Difference Award. You must have a lot of trophies and plaques in the house.
All hidden in my office and dusty. They're good.
And then finally, you have published on concussion management and neuropsychological assessment, and you're also currently working on our master's in public health through the Medical College of Wisconsin. So all that education, and you're still looking to get more. I love it. Well, thank you again so much. I know we have a lot to talk about. Really, today's topic is really what's the impact on quarantine on our youth. We have a lot of kids that are unknown on what they're doing with school. They've been quarantined for a while. They've been at home trying to study, learn. Parents have been stressed out. So a lot of that's going to stop. Before we get started into the nuts and bolts of this Facebook Live session, let's first talk about your career path. I gave a pretty extensive bio, but first of all, what is neuropsychology and how did you get into it?
So, a neuropsychologist, we assess and treat individuals who've suffered a variety of neurologic and or psychiatric conditions. We talk a lot about the brain behavior relationship. So we know that I always tell my patients what happens to us physically affects us emotionally. What happens to us emotionally affects us physically. So as neuropsychologists, we study how the brain responds to both illness and emotional disorders. So I started off as pre-med in college. I loved biology and started taking my psychology courses and switched to psychology. And then when I went to graduate school, I found neuropsychology, which was a perfect blend of my interest in medicine and psychology. And I did my residency at a brain injury unit in hospital in Chicago. But then I did my postdoctoral fellowship at Henry Ford Hospital in Chicago and started working with Dr. Mark Lovell, who is one of the leading experts on concussion. And this is 1997. I was 12, when I started. But that was the first year the NHL had a mandatory concussion program. So that was really the start of my work with concussion patients. So a blink of an eye, and 23 years later, here we are.
Telling me I was pre-med and I'm like, how did I find out nutrition? But I realized I didn't do really well my first semester in school. So I was like, I guess nutrition's it. All right. So what does your day-to-day look like at Midwest Ortho or Rush University? What do you do on a day-to-day basis?
One of the things I love about my job is it's so variable, right? I mean, I only see concussion patients, but even my day-to-day is different. I may see a kid, who got hurt in a hockey game, and then I may see an adult who slipped at home. and then somebody who got hurt at work or in a car accident. People unfortunately suffer concussions in a very wide variety of ways, and how those injuries impact them are quite variable as well. So a lot of what I do is I always talk about unpeeling the onion and just trying to figure out what is going on with this person. How do we properly treat these symptoms, and how do we make appropriate recommendations in the acute stage? So I also, as you mentioned, I do a lot of research and I'm involved in a lot of committees. I'm really passionate about the notion of educating the public, not only on concussions, but all health and safety issues related to sports. And that's why actually I'm going to be graduating in December with my MPH, because sports are important and they have real value, and we need to be looking at sports, particularly for kids, from a public health standpoint.
Yeah, rarely you see someone who has a doctorate go back and get a master's, because usually the doctorate's kind of like that end piece, right? It's like, oh, I have a master's. I've been telling myself I want to get a doctorate, but I'm like, well, why? But you have a doctorate, now you're going to get a master's. So I guess it's all relative to what you're doing.
Yeah, well, I think in any program we learn, we have certain skill sets, right? And I wanted to learn a new skill set, and I really value the role of sports with kids. And I think that there's a lot that we can do to keep these kids engaged in sports they love, but improve the safety around them. So that's probably the thing that makes me jump out of bed every day.
Absolutely. Our youth are so important to us. And that's really one of my first questions to talk about is really, what is the mental health state of our youth currently? What are you seeing in your practice right now?
Well, I think like with everything these days, we have to talk about everything from a pre-COVID and a post-COVID world, right? And even prior to COVID, we knew that mental health disorders, particularly depression and anxiety, are significant with our kids. It's something that we need to address. And if you look over at the data over the years, we've seen an uptick in those numbers. Now, is that a true increase in the number of cases, or is it just a better recognition and better treatment? Not really sure. But we do know that a good percentage of our kids are struggling with these conditions that really warrant treatment and benefit from treatment. So if you look at post-COVID, there's not really good data yet coming from the United States. Obviously, this is a new entity and research takes time. But if you're looking, there's some good data out of other countries like China, who have dealt with similar epidemics in the past or currently dealing with COVID. Some of the research suggests a 40% increase in these conditions in adolescents, which is enormous, and it's really going to strain our mental health capacities. And 58% of those who endorsed mental health issues rate their symptoms to mild severe. So these are not small changes in our youth that we really need to be watching very closely.
Now, outside of COVID, what are some of the factors that you feel have impacted the mental health of our youth and young athletes?
So that's a great question. And, certainly people talk about things like social media and, just the bullying and hazing and drug abuse. There's a myriad of factors. Like anything, you never can pin it on one thing, right? People are very complex. Kids are pretty complex as a parent, I can tell you, parent of teenagers. And so, there isn't one answer. And that's one of the things that we're looking at is a broad approach to mental health, issues in kids.
So since the lockdown, we know kids have been at home. Some kids, my daughter's in a camp, but at the same time, there's kids all across the state they're not allowed to go places. And we know that probably has a pretty significant impact on just their emotional status. But since the lockdown and quarantine back in March, do you feel this has created more stress for those involved in sports or even not in sports? And especially for those that are, because they're constantly on the move. How does this impact those kids that are used to structure, but may not have that structure now and locked in a house?
Oh, absolutely. And, and first off, to say, I am a very strong proponent, of sports for kids, because there are so many benefits, right? We know that physical activity is key. I mean, obviously, as a nutritionist, Tevis, we are very concerned about the obesity numbers of kids in our country. So for many kids, the only regular exercise they get is through sports, right? We know that they have increased socialization. We know that athletes get a routine, right? They practice before school or after school. There's a structure to the day. It keeps them out of trouble, right? We know that there's a real, a positive psychological impact of the identity of an athlete. It's a positive self-identity. We know that particularly in girls, there's a positive body image that's important. We know that sports teaches resiliency. It teaches time management. It teaches you to lead, right? That a lot of, Fortune 500 CEOs talk about the fact that they learned that they were a leader on the sports field and the courts, right? And there's also a real benefit of the relationships that kids have with their coaches. That so many coaches are an incredibly positive role model in these kids' lives. So all of those things are great, right? So when you don't have those things, we're going to see some negative effects. But that's not to say that non-athletes are skating through this, right? Non-athletes also have the same loss of structure of routine in their day. And, many kids may not be in the sport, but they're in band, they're in Spanish club, rocket club, econ club, whatever their interest is, right? Yep. And those are great. It's the same thing. They have structure. They have a love of something, right? That gets them excited about it. My son is really into rockets, and that, gets him so excited. So they're also losing those activities. And all these kids are losing milestones. I mean, we all felt really bad for these kids who missed prom, right? And they missed graduations and all those rituals of school that have real value in our lives. So I don't want to just say it's just about athletes, right? I mean, we study athletes, we talk about athletes a lot because that's our world, but even the non-athletes certainly are struggling with this. And one of the biggest issues that we're concerned about is just increase in isolative behavior, right? If I'm not going to school every day, am I spending all day in front of the computer alone in my room, staring at my phone? That's not good, right? We know that isolative behavior really tends to lead to increase in depression and anxiety. So that's a concern, athletes and non-athletes alike.
Yeah. So, we've seen, as you mentioned, the start of COVID. Now we're moving into a different section, whether depending on phases of those states. And in some of these cases, fall sports, not just sports, as you mentioned, it could be fall band. It could be my daughter loves singing in theater. It could be those things are not going to be available, and they're going to have those limited extracurricular activities. And
exactly.
How does this continue to impact the mindset of those students that are involved in those routines or those after school activities? Is there going to be additional stress? And obviously we're going to talk about how parents can get involved, but what do you think that we can do there? What do you think those young individuals are going to experience?
Well, it's really difficult because it's constantly changing, right? I mean, we know, I'm here in Illinois, in Chicago, and the Illinois High School Association, the IHSA, was leaning toward moving these kids back, right? Because Illinois has been doing a good job, and then we saw this uptick. And so now everything's sort of coming back. So kids are struggling because of the unknown, as we all are, right? So we have to acknowledge that for kids and understand and not make definitive answers. And I think a lot of coaches are doing a great job with saying, here's the plan. It may change, and we're going to adjust. But letting them know that we all are focused on trying to get them back to sports, back to activities, back to some normalcy. It's not everyone's throwing their hands up and, and saying, we can't do this. Everyone who's involved in youth sports and school systems are desperately trying to figure out a way to keep our kids active and of course, safe.
Yeah, and I think it's not just kids too. I mean, I think we're seeing what it's done to adults not having sports to watch. I know for me, I love baseball and football and all these things. And I'm like, okay, good. Baseball's supposed to start Friday. They won't have fans in the stands, but at least we have something to watch. We have something to think about planning our lives around. Even for those that are not in sports, it's okay. There's things that we've been taking away. And you look at, let's say some sports, we've seen schools like Stanford, they've cut 11 sports we know due to budget, due to the unknown. Some of these kids they're going to have to find a new school. They're going to have to find a way to change their scholarship. What that's going to look like. What would you tell those students in regards to how to overcome some of those stressors? Because I'm assuming, they're going to honor those scholarships this year, but maybe next year that school might not have, or that sport might not be able to come back because of money. what can we do for some of those athletes that have to go, or individuals, they need to find something new to do? Is there any advice that you would give them?
Yeah, it's part of the issue is first off focusing on the fact that you're not alone in this, right? It's not just, the state of Illinois, as an example, everyone is shut down. The entire country and the entire world are dealing with the same issues. So you're not missing an opportunity solely because you were injured or your school program was shut down. Everyone's in the same boat, and there should be comfort in that, and that the schools want to have these programs. Yes, there are things that are being temporarily cut, but colleges are going to have sports again when nobody can predict, right? But we know that as Americans, we love our sports, and our kids love these sports, and we love to engage them, play them, watch them, bet on them, right? Play them on video games. We love sports. But so it is to try to reach out to your coaches, reach out to the schools that you're interested in, ask them, are there scouting in other ways? Can they send videos? Can they send stats? What is the status, right? Stay active and engage with those schools that you're interested in, because they're trying to figure it out too.
Yeah, guys, we're talking to Dr. If you just joined, I know some people have just come on to the Facebook Live. We're talking to Dr. Beth Pieroff. She is the board-certified clinical neuropsychologist for Midwest Orthopedics as well as Rush University. If you have questions, please put them in the chat box and comments. We will get to those at the end. We're just about midway through, so a lot more questions as we move through this Facebook Live. I've seen some studies now that looked at the psychological impact of quarantining on adults for extended period of times. Outcomes such as increased post-traumatic stress, anxiety, irritability, insomnia, all deteriorating work performance. Let's transition that to our youth. Could we see similar outcomes if we continue to keep our children confined with little social outreach?
Oh, there's no question. We're going to see an increase. Now, it's so dependent though, right? First off, some kids are more resilient than others, right? Some kids are less affected by social isolation than others. We have to understand that there are differences. Even in athletes, I've spoken to some athletes, some kid athletes who initially at least were enjoying the break, right? They're playing their sports 6 days a week, and it was intense. So we have to understand that there are individual differences here. And it's really going to be dependent on the family, the school system, what's going on in your state. Every family is dealing with different stressors here. One family may actually be dealing with someone who did have COVID and is dealing with the actual physical ramifications of the disease. Some families may be struggling with, and dealing with an elderly patient, parent or grandparent they're trying to keep safe. Some people are, obviously many people are dealing with the financial stressors of this, while others are not. So we have to be careful that we're not making blanket assumptions about how everyone is handling this. It's really about watching, right? It's monitoring those symptoms. It's asking those questions. It's being aware that, yes, there are people who are having mental health issues secondary to what's going on in the world.
Yeah, and it's interesting because my next question is going to shift to school. And I just got off the phone with a gentleman earlier today, and we're just talking about some things. His dad passed away from COVID earlier in the year. His wife had it. His wife is a school teacher, and they had a retirement party for one of their principals, and then they all went to a buffet, and we're obviously using ladles and touching things, and 16 of those teachers have all tested positive for COVID. So that kind of leads to my next question. We're going to shift to the upcoming school year, and because there's still a lot of unknowns. Some states maybe are going to have kids in class with certain restrictions. We know here in New Orleans they're going to start virtually in some places. So, and that's going to really change a lot of approaches for parents, probably put stress on parents. But what do you feel is the best approach for the kids and teachers? Is there a best approach, or it really should be based on the risk factors in that location?
Well, that is the $1 million question, right? That everyone in this country is grappling with. And here's the thing, everybody wants our kids back in school. I mean, that's the goal, right? We know the benefits of having kids in school. We know that they learn better in the school than e-learning. We've seen those numbers. We know that they benefit from being around their peers. We know that for some kids, school is a safe environment, that unfortunately they live in violent homes. We know that a lot of kids get their meals from school. So there is extraordinary benefit to children actually being in a school environment. The problem is the unknowns here, right? We don't know the risk of kids getting sick, because there is a study just came out a few days ago showing that kids aged 10 to 19 can infect other people as easily and as well as adults do. We know that kids are seeing a lower rate of infection, but it's hard to look at that numbers because we've locked kids down, right? Kids are not out, they were out of school. So we put them back in the school environment. Are we going to see increased rates? So kids are having, so there's some blood conditions that we're seeing. So it's not as benign as people want to make it. And plus we have a whole bunch of adults. You've mentioned your fiance is a teacher, my sister's a teacher, and they're coming home, even if they don't have pre-existing conditions, they're coming home to people who may have those conditions. Plus the biggest factor is we really don't understand what pre-existing factors or what body types, DNA, blood types, factors contribute to one person getting sick and one who does not, who passes away. So there's just the unknowns that is just incredibly difficult for everybody right now when it comes to education. And I think all these schools are really trying to do their best. You're going to see a lot of change. What is a school system is saying now, maybe different a week from now, a month from now. We may have kids who go back. I know in our district, they're talking about going back 2 days a week, 3 days a week e-learning, and that may change. We may be 2 weeks in and that change. So, some flexibility is unfortunately going to be the norm here. And that's devastating for people with little kids. My kids are older. I, appreciate how difficult it is when you have a first grader. You can't leave them at home, right? So,
and you mentioned for those teachers earlier when we're talking offline, it's the viral load, because if you have 20, 30 kids in that room and, exactly, all of a sudden you got those little viruses running around and that teacher's exposed to, let's say, 10 or 15 kids that have no symptoms. And right, all of a sudden, boom, that viral load hits because, we talked about people that might not be in the best physical condition or mental condition, but they get COVID and have no symptoms. And someone who's elite triathlete who had it that I know, she's like, this is awful. I feel terrible.
Right.
So that viral load you mentioned is pretty critical in this case.
Yeah, and for the people who don't know, viral load just means sort of amount of exposure. So, if you're going out and you have some brief contact with someone, you're not going to have an exposure. A teacher sitting in a room for 8 hours with 30 little ones is a very high viral load, right? I mean, that's why anyone who knows any teachers, when you're new teachers, they get sick a lot, right? Because they're just exposed to a lot of germs on little ones until they build up an immunity. So that's just part of being, unfortunately, part of being a teacher. But getting a cold or getting the flu is very different than getting COVID. So we need to have that level of seriousness about the exposure that we're allowing not only teachers, but everyone else who's involved, every other person who's involved in school. We have custodians, we have aides, we have cafeteria workers. The list is actually quite long. Bus drivers.
Yeah, it's not just teachers. I mean, obviously, we think of them first because they're really kind of the first responders that are going to be there all day in front of them. But you're right. It's all these other individuals that might have pre-existing conditions and comorbidities that could put them at risk. Now, we've talked a lot about mental health. There's also the physical side of things. I know we've seen some studies that look at quarantining kids and the impact of obesity. And, if kids are stuck at home and they don't have that ability to be active, then are they going to eat more? Anything from the psychological side, or how do you feel from the mental and physical side, with those compound impacts on kids' health long term, like the trickle down effect, not catching the virus, but maybe 3 years from now, 5 years from now, how does that impact a young individual?
It does, and it's good you brought that up, because one of the studies out of China that looked at a previous pandemic was showing that loneliness, we talk about social isolation, right? The loneliness is really a key factor here. And that the longer that period of isolation, that loneliness went on, the longer it had an effect in the future. So this wasn't only what was happening at the time, right? That it impacts people moving forward. So we really have to be looking at mental health needs, not only immediately, but as the world starts to turn back to normal. How has that impacted our kids and their viewpoints? Because the world's a scary place for kids right now, and they don't understand it well. We don't understand it well, right? And we work in healthcare. And so there's a lot of fear that we need to be addressing with kids as we move out of this.
So I think my second to last question really is now for the parents that are listening. What can those parents do to kind of offset the potential impact of being quarantined or any stress long-term on their kids? Any advice for parents on what can they do with their kids?
Yeah, there's a lot of actually good recommendations out there. So one of them is, first off, open a dialogue. Talk to your kids. I always say to my patients, I don't know what's rattling around up in your head unless I ask you, right? We don't know what kids are hearing and what they may be misinterpreting from what other kids are saying or hearing, seeing in the news, seeing on social media. So we need to ask them about their fears to see if they're actually realistic. And remember, kids are little sponges. So if you're really stressed out, they're picking that up, right? They mirror anxiety, they mirror, other mental health issues. And so if you are very stressed, let's say about finances, because you're worried about your job, you need to talk to your kids because they all may also have unrealistic fears. So maybe they're hearing about, evictions and they're worried they're going to be kicked out of their apartment or their home. But maybe that's not something that's actually a real issue for your family. Talk to them about that. Help them, assuage that fear, right? So minimizing the amount of news they get. And I realize it's hard with kids with their phones, but this is true for adults too. You can't spend all day staring at the TV, listening to news. It's too much doom and gloom, right? And so we need to be informed, but we can't be swimming in it. That's not good for our mental health or the mental health of our kids. We need to look at screen time. And I know it's sort of a meme that was going around that prior to COVID, we were all strict about the number of hours our kid could be on, Facebook or iPads. And after COVID, we're like, whatever, I'm just trying to figure this out. Well, we need to ease back into that about looking at the amount of screen time our kids are getting. It's not healthy for kids to be staring at their iPad or their phone or their video games all day. So we need to sort of be re-examining that again. And routine is really, really important here. Adults and kids benefit from a routine. And listen, I have a 15-year-old. He's not going to bed at 10:01 and getting up at 8 o'clock every day. I get that. But we need to enforce some structure back in our kids' lives, be it a sleep schedule, chores, some sort of academic work, whatever you want to do, exercise, something that puts some structure back into their lives. We're overstructure, right? I mean, it's still summertime for these kids, but having a routine is important. And sleep being a really important part of that. Sleep is absolutely integral to our mental health and our physical health. And kids going to bed at 2 o'clock, sleep until noon one day, then, erratic sleep schedule is not good for mental health. Anyone who's ever had a teenager who's tired, we know they can be a little bit more irritable. And so we want to make sure that I always tell my patients, put a firewall around sleep. Sleep is important. Certainly a healthy diet, and Tavis, way more about this than I will. But nutrition is really important to our overall health. And we want to start going, okay, if I can't get my kids involved, if they can't be playing sports, can we encourage other activities? There was one study out of China that talked about introducing art and photography to kids, that they were expressing themselves through art, right? So can we do other things, obviously safely? Can we have them get together with, other people in small groups, mass, socially distanced? Kids need socialization. I appreciate that parents, adults are a little zoomed out, right? I know I'm really tired of looking at small faces on a computer, but kids need that, right? They need interaction just besides texting. So let them FaceTime with their grandparents or their aunts or their friends. Let them get together and giggle with classmates. Let them get in small groups if it's safe to do so, right? Again, following your local restrictions based on what's going on in your area. So start to ease back into some of these things. And if you're in an area where sports are getting back together, please have a conversation with your coaches about making sure they're following those guidelines. We want our kids back in sports, but we don't want is this all or nothing thinking, right? That they're just going back to practice. That some of these sports can be modified to keep social distance. My 12-year-old plays hockey, and what they've done is the kids have to go in fully dressed, skate guards on, meaning they walk in with their skates, take the skate guards on, they're on the ice, they're social distance, they're masked under their helmet, no parents are allowed to watch, and then they get off the ice. So it can be done responsibly, but you need to have a conversation with your coaches and your organizations about what guidelines are they following.
Right. That's excellent. That's a great feedback. Final question is just any other recommendations you would give to just the listeners on today's Facebook Live session?
Ultimately, I'm saying cut yourself some slack here. There is no perfect answers. We don't have any answers, and when we think we do, they change. Perfection is not the goal here. As parents, as healthcare providers, we're all just trying to do our best. So take care of yourself, making sure those same things that you're doing for your kids, you're doing for yourself. You can't pour from an empty cup, right? Seek out help if you are struggling. One of the positives, I guess, of this is that most mental health providers are doing treatment virtually, so you don't have to worry about driving somewhere. There are resources available, particularly if their stressors are so bad and there's thoughts of suicide. Reach out to your local suicide hotline. There are resources available for people who are really struggling, but remember that we're all in this together.
Absolutely. Now, before you go, we're gonna get to the question shortly. I have 3 curveball questions for you now. These are not things I've sent you. They have nothing to do with today. They're just fun questions that I never told you about. So just things that we like to ask. It's just kind of fun and break up the seriousness of the talk. If you were to be the lead singer of any rock band, who would it be?
Oh, good question. It's so funny. My favorite singer is Bob Seger because I'm old and I love Bob Seger, and so anything along that. But I have a pretty wide variety of music, so that's why I hesitate because I love R&B and I actually like rap. My son and I listen to rap, and it's a good question. I don't know, and trust me, nobody wants to hear me sing. Nobody. That your ears will bleed. So that is not something that I should be see as a goal for myself.
Now, I love music. My daughter and I play guitar, and she sings. We'll do open mic night every other Thursday. So it's a lot. I
love it.
And we have, she's got a wide variety. I'm more the alternative rock, heavy metal, which people are like, what? But but we blend in everything. So it's kind of fun. If you could have dinner with 2 people, only just 2 people in the whole world, who would those 2 people be?
2 people in the whole world.
Or 2, let's say, two famous people, if we want to call them famous. Or just anybody that, whether they were alive today or alive yesterday or just no longer here.
People who, if someone's no longer here, oh God, this is such a good question. I have so many people going through my head, and I'm trying to be apolitical because we're trying to. I'm trying to stay away from those people. I honestly, I think it's more like to be a dork. I'm sort of thinking neuroscience people. I'm thinking about Lurie, and I'm thinking about people in medicine. Jonas Salk. People like who gave so much to the world and how they come. Marie Curie. God, that's so pathetic. But yeah, I just it's people who are and there were intellectually curious. Galileo. Right? Like people who sort of went against what the norms people were saying and persevered.
Yeah, no, I know it's tough because I'd be like, and I'd have a couple of people in mind, but yeah, that's a tough question. Last one should be a lot easier. What's probably the most unique place you've ever visited?
Oh God, I love to travel, so I've traveled a lot. 3 years ago, I went to Croatia. I actually presented at a conference, and and concussions. And that was great. And I had never been to that part of Europe, and it's a beautiful country. I strongly recommend it. Split is gorgeous.
All right, so we have a question from, her name is Beth. It's kind of funny. So we have a question for Beth, for Dr. Beth. If we have a kiddo who shows signs of depression because of the isolation, what should a parent do?
So first off, again, I have a dialogue, and that can be tough based on age. Obviously younger kids have a harder time sort of articulating their emotions. And so one of the things that is really, really tough for parents is to talk about suicidal ideation. All right. People have a false belief that if you ask the question, you're going to introduce that concept to people. And that's just not the case, right? As humans, we all know that that's an option. And we are very concerned about suicide in particularly young people. Young people lack the ability to control their impulses. And so a lot of times suicide attempts or completions in adolescence are due to that impulsivity. So if you're really worried about a kid, you need to ask those questions about, do you have thoughts about hurting yourself? Do you have thoughts about not wanting to be alive anymore? It's a really tough conversation to have, but it has to be done, right? You need to know if that's going on. You need to understand also too, again, what we talked about before, what are their thought processes? Maybe some of their fears that are driving some of this are unfounded, right? Ask them what they think they need. I think the problem that we had is in the initial shutdown, we all kind of felt it was time limited, right? Like, okay, if we shut down for a month or 2 months, we'll get past this. And part of that is difficult for people now because we don't have that end date, right? And we have this weird sort of mix of restrictions versus all, everyone was staying inside. So talk to your kids about what they think they need. What would make them feel better? Start having that conversation and really start reaching out for local resources if you feel like your child would benefit from that. All right. There are people who are very good at their jobs in all parts of the country. And what I tell people all the time is that no matter how loving you are as a parent, no matter how supportive you are as a parent, kids really do benefit from having somewhere safe to talk about their emotions, that whatever those emotions may be. So that's the benefit of therapy, is having a safe place, having someone who's trained to know how to manage those emotions and what to do with them, and help find more adaptive ways. Because one of the things I think I failed to mention before is, we're also worried about substance abuse, right? In adults and kids. Many ways people adapt how they manage their stress and their emotions are substance, right? Alcohol and illicit drugs. So we need to be watching that for our kids and our adults as well. So therapy is about finding more adaptive ways to manage those emotions.
Yeah, and just the last question before we let you go, are there any exercises, and I don't mean like physical exercise, but mental exercise? You mentioned art. You said that's kids drawing or just keeping their mind active. Any other recommendations you would have there to keep kids' minds active so they're not stressed or thinking outside of that?
Yeah, I mean, it's a tough question because it really depends on what their symptoms are. We treat anxiety differently than depression as an example. But so, a lot of kids this is really anxiety provoking for kids, right? So things like deep breathing, meditation, mindfulness, yoga is a great way of people to increase the sort of mindfulness. And that just means drawing your attention to the current and not thinking about the future or worrying about the future. And so there is lots of things that can be done. I mean, you can great meditation and yoga practices right through YouTube, right? There's free apps that can be used. So one of the benefits of technology is those resources are available to parents and to kids.
Dr. Beth, this has been an amazing Facebook Live session. A lot of incredible information. We really appreciate you taking the time today to spend, 40 minutes of your time with us. And I know a lot of our listeners are going to really benefit from your feedback. So thank you so much.
Thanks so much for having me. I appreciate it. And thank you so much for the work that the Taylor Hooten Foundation does. What you guys do is just really, really important.
Thank you. No, we appreciate it. We look forward, hopefully, to seeing you again with another program with the Blackhawks or, any other organ. I know once you guys were able to have conferences again and we're able to travel and get out, we can't wait to get back on the road and present in front of the audience.
Sounds great. Thanks, Travis.
Thank you. Have a wonderful day. Thank you so much.
You too. Bye-bye.